My name is Nikki Crocker and I'm the Director of Infection Prevention. So just want to take a couple minutes today to tell you what this team is all about. I think that most people believe that IP primarily focuses on hand hygiene, CAUTI, and CLABSI, which is a huge part of what we do. But there's also lots of other things that this team focuses on that you may not be aware of. So one of the big things is surveillance. We look at surgical patients. So if you've had your knee operated on, if you've had your colon, a hysterectomy, we look at infections related to those things. Once we find those infections, then we end up reporting those to something called NHSN. That is a national database where we enter all those findings and it compares us to other hospitals, so we know exactly how we're doing. And if you've ever heard of a SIR or seen that reported, that's where we get that from. That's a big part of our day. Another thing that we monitor is something called reportable conditions, and so that is basically just communicable diseases. That is a huge part of what we look at here. Of course, we are infection prevention, so we want to prevent all the diseases. Some of the ones that you are probably aware of that we look at, flu and COVID, that's huge, and we always look at those and report those. But some of the ones that you may not be aware of that we look at are other communicable diseases such as STIs. We look at patients with hepatitis, tick-borne diseases, meningitis, tuberculosis. So as we find those diseases in those patients, we report those things to the Department of Health. That way, the Department of Health can track those patients. They can use those patients, that information for follow-up, and they can use that information for treatment of those patients once we report that. So that's another large part of our day. You also should pretty consistently see the IP staff, the IP team out rounding in your areas. The other things that we do as far as rounding is concerned, we have newly implemented some isolation rounding. So if you have isolation patients in your area, you're going to see Hillary out taking a look at those isolation caddies, watching you go in and out of the rooms. We want to make sure that everybody is washing their hands, they're putting on and off their PPE accordingly, and that we have the right signs in place to protect everyone, whether it is a staff member, a family member, or a physician who enters those rooms. So isolation rounds are huge, and you should see that taking place consistently. We of course also look at Foley catheters, we look at central lines, and the big one, hand hygiene. We're always watching people wash their hands because that's the #1 way to prevent infection. We look at cleaning products, we look at different safety devices, so if we get new insulin needles, just making sure that it is the safest for our nurses and our patients. We also follow up on every single incident that's entered, so if you have a blood or body fluid exposure, if you have a needle stick, of course you enter that on MissionNet, and then we follow up with every single person who puts in those reports. The purpose of that is because not every needle stick or exposure means that you need to have treatment. We want to weed that out and make sure that you weren't truly exposed and don't need treatment, or if you were, get you the treatment that you need. So we follow up on 100% of those as well. So those are just some things that IP does that you may not be aware of. And again, you should see us out a lot, just doing some rounding, answering questions. Don't hesitate to find us if you have a question, whether it is about any of the reportable conditions that we have, if you have had an injury, if you just have questions about isolation. That's what we're here for. We want to help keep our patients as safe as we possibly can.